Everybody in America should get the best care available. And it's not about spending money. It's about processes and workflow and getting information at the point of care so that people will be able to receive from their doctor the best care possible. There are several states in this country who have decided not to expand Medicaid under the Affordable Care Act. They didn't take the expansion, they didn't take the federal money. Guess what? Many of those states, not all of those states, are also at the bottom of how healthy their citizens are. How do we fix it? I think we fix it using information technology. We do that for banking. We do that for shipping. We do that for manufacturing. We do that for every single industry. Why aren't we doing it for healthcare? And if you've ever seen an electronic health record, tab, 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 where do they go look for it? They only have 10 minutes with you, 15 minutes, 20 minutes. They had an hour with you, they couldn't review all of your information. We invented vaccines for COVID in less than a year, while the previous time for measles took 4 years. That is absolutely incredible. So let's think about the experiences that we have in our life, right? Our banking experience, our Amazon online experience. I'm not going to bring up our cable experience right now, please. We won't do that. Yes, too painful. And information technology tools, which exist today but have not been implemented properly, not have been deployed properly. They exist. We have to figure out a way to get them deployed and utilized in the right way. Think of the best experience you have outside of healthcare. Wouldn't you want it to be like that? Easy, simple, connected. In my career, I've worked with some of the best healthcare providers in the world. Mass General Brigham, right here in Boston. University of San Diego. Sutter Health. Kaiser. Province of Alberta. Saudi Health. But one of the things that I've noticed is there's huge variation in the care that they provide. We have to demand great health care from the people who are taking care of us. We have to let them understand that they have to rise to the occasion. The services that they provide have to be at the best possible, and that our experience has to be great. So what do? Are we going to decide to settle for treating everybody at the least common denominator? We're going to treat every person with asthma the same way, every person with diabetes the same way, irrespective of their family history or their genetic makeup, and we can ignore everything, all that we've learned in the last years about genomics? We have a history in this country where when we did medical research, we only did it on white men. Too bad for all the women. The dosing was set for white men. What about women? Last I checked, biology is a little different. I hope some of you have figured that out by now. So we need information technology tools that allow that patient to be screened for those things that may be rare. So the physician is not the endpoint of the knowledge base that figures out what that patient has or not. How can I be a good consumer? How can I be a smart consumer? How can I protect myself if I don't know? Everything else I buy in the world, I look on Amazon, I look at the reviews, I go to TripAdvisor, Reddit, whatever, I can find out. I have no idea. What they should be doing is figuring out how they can deliver care more efficiently, how they can deliver it better. But that takes time. And you know what it really takes? Effort, commitment, involvement. So what you got to do is read a little bit, not to figure out what you need to do, but figure out what questions you're going to ask. And then you have to put your trust in somebody, that clinician, that doctor. Ask them the tough questions. That's the way you'll be able to get great health care. That's how you get involved, by not having answers, but by asking questions. Let's deploy them in the right way to make sure that we keep those clinicians, we keep those nurses. And frankly, they'll be there when we need them to take care of all of us. And that's incredibly important and something that we actually absolutely need to work hard towards. We have to take care of them so they can take care of us. Get involved in your healthcare. Demand excellence. Tell people, tell your organization, tell your provider what you want, and tell your payer that you expect a certain experience from them that is valuable to you, that's meaningful to you, that you understand. And if we do all of that, we can make healthcare better for not just us, for everyone.